Alright guys, we're going to jump right on into our last video. Here we're going to start talking about intradermal injections as part of parenteral medication administration. So where do we give intradermal injections? They are going to be given anatomically on the anterior forearm, halfway between the wrist and the elbow. So in our picture here off to the right hand side, we can see that this patient, their bend of their elbow is going to be around here, and their wrist is going to be about here. So they're using this anterior area of the forearm. You can also give intradermal injections on the back, below the scapula or below the shoulder blade. So why do we use these areas, and why do we use intradermal injections? So here in these areas, the hair is sparse. They're not over any type of bony prominences. Veins and arteries are not as close to the surface. They also have a very slow absorption of the very small amount of medication in these sites. And these sites are also excellent for testing for allergies and TB exposure. So when we give an intradermal injection, the angle of injection is going to be very small, so 10 to 15 degrees. So here in our picture, we can see that this MA is giving this medication at a very slight angle, that 10 to 15 degrees. They're not coming in from the top, going straight in. She's kind of angling it very slightly to enter the skin, not so deeply. So we can only put a maximum amount of 0.1 mils or milliliters inside of that site. Very small amount, guys. So because of that, we can only use a syringe size of 1 milliliter. We won't need a very big syringe because we're not putting very much liquid into that site. For our needle size, we're going to use a 25 to 27 gauge needle. Remember here, the bigger the number, the smaller the needle. Okay, and then we only need a 3/8 to 5/8 inch needle. That's a very short needle, not very long, because again, we're not going very far in the skin. So here, the patient position, we want them seated with arm support if we are indeed using that forearm. And some examples of an intradermal injection would be a PPD, or that purified protein derivative, to test for TB exposure, and for allergy testing, sensitivity testing. Remember again, I do need you to watch all of these videos, so please refer to your PowerPoint and click these links to watch how to give an intradermal injection. Okay, so switching over to intravenous injections. Intravenous injections simply mean into the vein, intravenously. So different sites that you can use for intravenous injection, most commonly found in the hand, forearm, and cubital fossa. That's going to be your bend of your elbow, and your dorsal venous arch, which is actually in your foot, which is less commonly used. So advantages of IV injections: ease of access to superficial vessels with limited risk of damage to nerves, and easy differentiating between the arteries and the veins. So easy to access those veins and those vessels. And also it's rapid action due to actually being inside the vein into the bloodstream. So here when we start an IV, it's actually going to be a 25 to 30 degree angle that you insert the IV catheter. And again, remember our intradermal, that was 10 to 15 degrees. So here it's a slightly bigger angle at 25 to 30 degrees. Maximum volume. So there is no limit to IV injection. We can put bag after bag of IV fluids into a vein, as long as that vein is working properly and it doesn't blow or anything like that. There is no limit to the maximum amount of volume you can put inside that vein. The rate of infusion, so how fast, how quickly you're inserting that medication, is based on the purpose of the infusion and oftentimes what kind of medication you're actually putting in there. So needle size, 20 to 24 gauge, is going to be a little bit bigger needle, and 1 to 1.5 inch. The syringe depends on what exactly we're giving as far as medication, and it's as large as needed to dilute the medication to be administered. Here, when we start an IV, the patient is going to want to be seated or reclining. Some patients do pass out with IV injections just from the anxiety and the stress of being stuck. So you want to make sure that they are supported. And just some examples of IV injections: antibiotics, morphine, Benadryl, Ativan, etc. Just maintenance fluids, those kinds of things can be given intravenously. So just a note, MAs are actually not allowed to start IVs. So I need you to understand and know about intravenous injections. However, you would not be starting an IV on a patient. All right, subcutaneous injections. So subcutaneous injections are given into the subcutaneous tissue. Here, the different sites, we can use the abdomen, and that's going to be any area that's 2 inches away from the navel. Posterior aspect of the upper arms. We can see here in this picture they are using that back side of the upper arm. Or you can also use the upper outer area of the thighs. So all of those areas have a little bit more fat, and that's where we actually want to get the medication in. We're not going all the way to the muscle. We're going to keep that injection into the subcutaneous tissue. So advantages here, thicker fat layers, ease of access, versatile. So you can use these types of injections for short-term or long-term therapy. So long-term, insulin users use subcutaneous injections. And it's a little bit slower absorption of medication and can sometimes take up to 24 hours to work. So here, the angle of injection is going to be 45 degrees. In this picture, it's not a very good, adequate representation of that 45-degree angle, so please don't take this picture to heart, but just know here 45 degrees. Remember, our intradermal was 10 to 15, our IV was 25 to 30, and here 45 degrees for angle of injection. So maximum volume is going to be 1 to 2 mils, maximum for these sites. The needle size, 25 to 27 gauge. Remember, the bigger the number, the smaller the needle. 3/8 to 1 inch. So remember, with our intradermal, it was only 3/8 to 5/8 inches. Here we can go up to 1 inch because we're going a little bit deeper than an intradermal needle will need to go. However, we don't need to get to that muscle, so we're not going to use a very large, long syringe. Syringe size, most of the time you're going to be using a 1 milliliter or 3 milliliter syringe. Here we want that patient seated or in supine, depending on the injection site we are using. Examples here would be heparin and insulin, very commonly used medications with subcutaneous injections. So that was subcutaneous injections. Now we're switching over to intramuscular injections. This is the one that most people should be familiar with because most everyone has gotten their vaccines, and here they do intramuscular injections for vaccinations. So all intramuscular injections are done at a 90-degree angle. Different sites can be used for these intramuscular injections. The most commonly, or the one that most people think of, is that deltoid muscle being used. And that is what we have here in this picture. This provider is using the deltoid muscle to give a medication. So this is given in the mid-axillary line, 1 to 3 finger breadths below the acromion process. So the acromion process is that bony point that kind of sticks out at the end of your shoulder, and you're going to use your fingers and just measure 1 to 3 finger breadths below that, and that's where you'll use that deltoid muscle. Here you can give a maximum of 1 milliliters inside that muscle. It's a smaller muscle, so it can't hold quite as much as these other sites that we're going to talk about in just a second. Needle size, 23 to 25 gauge, little bit bigger of a needle than used with the subcutaneous injection. 5/8 to 1.5 inches. So again, here we're needing to get to the muscle. So depending on the patient's body size and fat, you may have to use up to a 1.5 inch needle just to get through all the fat to get to that muscle. And the deltoid is actually the only site approved for the hepatitis B vaccine. Okay, so the next site we're going to talk about is dorsogluteal. This is the upper outer quadrant of the buttocks. Okay, upper outer quadrant of the buttocks. So if you take the butt cheek and you divide it into 4 quadrants, so you draw a big cross on it, on the butt cheek, where you're going to give that injection is going to be that upper outer area, okay? And the max amount you can give here is actually 3 mils. So this is a bigger muscle. Obviously, our gluteal muscle is much bigger than our deltoid, so we can put more liquid inside of it. So needle size is here, even bigger needle here, because a bigger muscle, bigger area to get to, 20 to 23 gauge, 1 to 1.5 inches. Okay, ventrogluteal. Ventrogluteal, this is our hip muscle. So this is the preferred site for IM injections. Here, what you do is you place your hand, the palm of your hand on the greater trochanter. That is the bony part of your hip, kind of where that bone sticks out on the side. You place your hand there with your fingertips pointing up, and you make a V with your pointer and your middle finger, and where that area hits is where you actually put the injection. On the next slide, we have some pictures, so we'll look at that in just a second. But here, our hip muscle is also a bigger muscle. 3 milliliters, the maximum here as well. Same for the needle size, bigger needle, longer length. And again, this is the preferred site for IM injections. Our last injection site is going to be the vastus lateralis. This is our thigh. So 1 hand's breadth below the greater trochanter and 1 hand breadth above the knee. So if you place 1 hand right below that hip, that bony prominence of your hip, and 1 hand right above your knee, that area in between is where you can give this vastus lateralis injection. So the max here is 2 mils, not quite as much as our dorsogluteal and our ventrogluteal, but still nice 2 milliliter amount. A little bit smaller than the other needles we had just discussed, just 21 to 23 gauge, and you may use up to 1 1/2 inch, just depending on the size of your patient's thigh. This area is appropriate for all ages, and if any of you all have kids or infants, you know that this is actually the go-to site for vaccinations when the baby is very small or child is small. So again, this one is appropriate for all ages and used from the time, pretty much from the time of birth. Okay, so here is a picture of our injection sites. Here's our thigh, that vastus lateralis muscle. Our arm, this is our deltoid muscle. Our hip, you can see here how I was talking about you placing your hand on that greater trochanter with your fingers pointing up. That hip muscle, ventrogluteal site. And then our buttocks, the dorsogluteal site, that upper outer quadrant of the buttocks right there. So take a look at this because we will be practicing identifying the sites in class. Okay, last thing. Guidelines for administering injections. Follow the 6 rights of proper drug administration. So remember your 6 rights. Always evaluate each patient as an individual. So each individual patient has their own needs, and you will need to assess that as you are administering injections. So like we talked about different needle sizes for different patient body types, that will be something that is important to look at. Select a needle syringe unit that is appropriate size for the proper administration of the specific parenteral medication. So like we just talked about, different sites, different type of medication, different area, so sub-Q, intramuscular, depends on what type of needle syringe you will need to be using. Correctly prepare the appropriate equipment and supplies for use. Wash hands and put on gloves, always, always. Select the correct site for intended injection. Prepare the patient properly for the injection. So again, going back to our patient education, which is always important. For sub-Q and IM injections or intramuscular injections, use a smooth, quick, dart-like motion to insert the needle. Not slow, it needs to go in pretty quickly. And then always use the correct angle of insertion like we talked about. Aspirate gently to ensure the needle is not in a blood vessel. If you do get blood return when you're aspirating, and I'll discuss this more in class as we're actually practicing, but if you do get blood return in that syringe, you will need to take that syringe out, needle out, and start over. With a quick, smooth motion, remove the needle from the injection site, the same as angle insertion. I'm going to let you read over these last few ones because it's about to cut me off. Please review these videos and prepare for your quiz in class, and I will see you in class for your quiz.